What causes inflammation of the gastric mucosa? Have you ever wondered what causes inflammation of the gastric mucosa? This condition, known as gastritis, occurs when the stomach lining becomes irritated and damaged. The most common cause is an infection with a bacterium called Helicobacter pylori. This bacterium can settle in the stomach lining and trigger an immune response, leading to chronic inflammation. It's also linked to peptic ulcer disease and may increase the risk of gastric cancer. But Helicobacter pylori is not the only culprit. Autoimmune gastritis occurs when the body's immune system mistakenly attacks its own stomach lining. This can lead to significant inflammation and damage. Another factor to consider is the use of chemical irritants. Chronic use of nonsteroidal anti-inflammatory drugs can inhibit protective substances in the stomach. This makes the mucosa more vulnerable to acid damage, contributing to inflammation. Dysbiosis, which refers to an imbalance in the stomach and gut microbiota, can also play a role. This imbalance can promote the growth of harmful bacteria and produce damaging substances, leading to chronic inflammation. Factors like diet, antibiotics, stress, and environmental influences can all contribute to dysbiosis. Lifestyle choices can further exacerbate inflammation. Smoking, excessive alcohol consumption, and a diet high in fat and sugar can all increase the risk of gastric mucosal inflammation. In addition to Helicobacter pylori, other infections like Fusobacterium nucleatum and Escherichia coli can create an inflammatory environment in the stomach. Physical and chemical injuries, such as bile reflux or radiation therapy, can also lead to inflammation of the gastric mucosa. When the gastric mucosa is inflamed, it becomes more susceptible to damage from stomach acid and digestive enzymes. This can result in the formation of ulcers, which are open sores in the stomach lining. Understanding these causes is essential for effective prevention and treatment. Eradicating Helicobacter pylori with appropriate antibiotics, avoiding nonsteroidal anti-inflammatory drugs when possible, and making lifestyle changes can help reduce inflammation. In summary, inflammation of the gastric mucosa arises from a mix of infectious, autoimmune, chemical, microbial, and lifestyle factors. Helicobacter pylori infection is the most significant cause linked to peptic ulcer disease. Always consult with a healthcare professional for personalized advice and treatment options.